Welcome back to the podcast, Katie. I'm so happy to have you back.
Thank you so much for having me. This is a really great topic, and I work with it a lot. So it's nice to get to
Awesome.
be on the podcast.
So good. So I remember our first podcast episode, we talked about about your gift really and how you also incorporate art, which I thought was so cool.
Yes.
And so now since then you've started to see a lot of people with fertility, like specifically fertility. People are coming to you like about loss, miscarriage, and also spirit babies, like future babies and babies who have, yeah.
I mean, I always worked with a little bit, but yeah, lately, like the past 6 months or so, I've really been getting a lot of fertility people, and I really, my heart goes out to them.
Mm-hmm. Yeah, for sure. And I feel like it's kind of like you're being called, you're being summoned.
Yes.
It's like a need. It's like a need in that world to really become a messenger in that space. And I think that I wanted to get your thoughts. Like, why do you feel like we're living at this time right now? Like this time, it seems to be more needed than ever. Like the fertility space, like there a lot more people are experiencing that. There's a lot more of that happening now, and I wanted to get your take on it.
Yeah, I mean, I think some of it gets down to just lifestyle changes and people having children, like getting married later, having children later, deciding to do that. And that's kind of age isn't necessarily a fertility block, as we know, but it definitely can complicate things,
Yeah.
So I think that's a piece of it. I don't know if there's more stress than in the past. It feels like,
Yeah, it
for
does.
sure. So, and we all know that stress plays a big part in it with the cortisol and the, effects on the immune system and all those kind of things. So I think that's also it. And I feel like people have more of a need to communicate with spirit in terms of their own personal relationship with their intuition and their body. And a lot of people, for various reasons, are kind of out of body. And
Right. It's true.
it's really hard to know what your body needs for fertility or anything else if you're not in it, or if you feel like it's your enemy, or you can't listen to the signals it gives you in terms of self-care, for example.
For sure. Yeah,
think
I agree.
Yeah.
I also like noticed. I remember I read your book, and I feel like with you, it's what's cool. What I really like is that you not only are connected to spirit, which I think that most people who don't really understand it think it's kind of like somewhere up in the clouds, or it's not like real, or not. It's hard to like kind of look at because it's not something that can be looked at. It's something that's more experienced. But what I find that's interesting about you is that you really pull it into the body.
Mm-hmm.
And you kind of like the intelligence in your body. It's almost like the messages that your body's giving to you, and that could be considered, yeah, like intuitive, but that's actually like something we all have.
Yeah, no, it's true. I try to, make it not woo-woo because it's really not. And we all have medical intuition. We use it all the time. Like, if you get a stomach ache, you immediately start thinking and problem solving, like, was it something I just ate? Do I need to have crackers? Do I need to get some seltzer? Do I, Pepto-Bismol? Do I need to lay down? Do I need to go to the hospital? So whether it's you or your kids, right? Because we do it for our family members also.
Yes.
So I think it's something that naturally happens. My abilities take it to the, nth degree, which is different, but it doesn't mean that people don't have medical intuitive abilities who don't do what I do. So
100%. I think so too. It's not, I think it's something that we've all been given because we need to have it. We need to know what's going on with our body, and we can have it too. It's not something, and I think that sometimes we also give the power away to other people to dictate kind of what we should do with our own bodies. And we also overlook our own intuition on what our bodies are telling us because we don't trust that. I mean, it really kind of goes on and on.
It really does. And I think people, if you have trauma or illness or something, the thought is that these feelings in your body are scary, or that there are enemies, or we have to fix them and obsess about them.
Right.
And I think a more practical way of looking at it is, what is my body telling me? What is my intuition telling me? If my chest is tight, that may be my intuition yelling at me that I need to do something different or whatever. And even like anxiety is so big. And I look at anxiety as, number one, it's very natural. It's a survival mechanism, right? We've always had it. We've always needed it. And it's letting you know that something isn't right. So it may be danger, or it may be that you're letting people take advantage of you, or not setting boundaries, or that you're not doing self-care, or you're doing something against yourself, or it just means something's wrong that we need to take a look at. And the more you push it down, the stronger it gets. So then it becomes a big thing in and of itself,
Yeah. But it's actually just trying to guide you. It's kind of trying to get your attention. And that's why I always say, like, symptoms, it's so funny because we get really annoyed with symptoms, but symptoms are our best friends. They're the best things that we could have. It's such a genius design of our bodies is to let us know what's going on and to guide us. It's when we fight with the symptoms, they grow bigger and bigger, and then they become like really hard to manage.
And then what happens is, the more we ignore, the worse they get, and the more that they need to interfere with our happiness and our health. And it's not even necessarily our faults, because we have a culture of just, grin and bear it, kind of.
It's true.
Just don't even, and there's something to be said for that as well. But like, you can't ignore what your body is telling you, and then also expect to be healthy and happy, because you're either
it's a disconnect,
or you're out here.
Yeah.
And if you're out here, it's impossible to be present. Most of us live in between. Like I live out there too. So but I have to be here, in order to function and help people too. So
yeah. And then, so talk to me about some of the cases that you've seen of late, because you've been talking to more people. I know we were talking before about a lot of loss. And I think that that's a really important topic, because it's so confusing. It's heartbreaking. It's just really hard for people, especially because not a lot of attention goes on that type of loss, like pregnancy loss. It's not given a ceremony. It's not, unless the couple decides to do it. So I think that, and then the community, sometimes couples go through it alone. So I think that it's a very unique type of loss in that way. It could be really, really difficult because of that.
It's, like I said, I really feel for people. And a lot of it is things that if you haven't been through it, like a miscarriage or whatever, or a fertility journey, right? If you haven't been through that, just like if you haven't been through anything, it can be hard to understand what a person's going through. But like, I was working with somebody recently, and she's been trying to get pregnant for, I guess, like 5 years now, and she's in her 40s. And she's gotten pregnant through various means, but they were all chemical pregnancies. So they only lasted about a week or so. And then even with the egg retrieval, all of her embryos have seemed to have some abnormality. So there's nothing that she can do, in terms of fixing that. And then the question is, like, does that mean that every time I try to get pregnant, there's going to be something wrong with the baby? And is there something wrong with me? And is there something wrong with my body? And just like, and this person I really feel for, because she's doing it alone. She doesn't have a partner, and so there's not even anybody to help kind of support you and pick up that slack.
Right.
And that loss just then turns, I think, to sheer terror of, and then
every single time you have to go through it, you're not going to be able to feel safe.
And there's a PTSD component to it of, do I get my hopes up? What if I get hurt again? What if and all of those feelings of grief and loss and everything come back every time you even think about doing it again.
Right.
And I just, like you said, it's not, and I think things like your show and other things have helped people be able to talk about it more.
Yeah.
But it is a foreign concept to a lot of people.
For sure. And so what do you see? Do you see like a spiritual component to it? Is there some message or something that they need to like address that they
Yeah.
feel to, at least to get through it, to get them stronger?
So I pick up a really mixed bag of things. It's not uncommon for me to pick up physical or emotional issues that need to be addressed before a healthy pregnancy could take place. And so things like Lyme, because Lyme can get passed on, to your kids. And if you have that, there's a lot of reasons why you need to heal as much as possible, before you
Right.
can have a healthy pregnancy.
Yeah.
What I pick up on a lot is something called Ehlers-Danlos Syndrome.
Mhm.
Have you heard of that before?
No.
So Ehlers-Danlos, one of the most prominent symptoms of it is hypermobility. So being ultra flexible, but even that can be different in every person. But it's a connective tissue disorder, and it's collagen and elastin that are always inflamed in your body. So you have this ongoing inflammation, but EDS impacts virtually every area of the body.
Wow.
And it's really, really crazy. I have it. My daughter has it also. So I feel like a guinea pig, have it, and I can help a lot more other people, which is good. And then I end up helping a lot of families because it's genetic. So people are
Right.
like, oh, I didn't know I had it. That sounds like my mom. That sounds like my sister, or, but the thing about it is that because your organs can be lax, because there's inflammation, because all sorts of things, and it screws up your hormones, a million things, that can be a hidden cause of infertility.
Wow, that's crazy because I've never heard of that.
Yeah, it's not uncommon. It used to be considered a rare disease, and there's 13 different types. So all except the most common type are pretty rare. But the most common is not rare at all. I pick it up all the time, and it's been getting more media attention, which is good,
Yeah.
because doctors are really bad at diagnosing it because there's all these symptoms. And so when you go to a doctor, usually all insurance allows them to pay for is that one symptom, which is crazy because you need to look at the whole body to know what's
Wow, that's
going
so
on.
crazy. And what could you do about it?
Yeah. So you can't cure it, but there's a lot you can do.
Yeah.
And so a lot of it is like testing for histamine sensitivities. For example, histamines come into it. They do all sorts of different, testing for autoimmune things, and just that kind of thing is valuable. But what was the most helpful to me in my treatment was getting to work with physical therapists who were specialists in EDS. And I was able to see like which parts of my body were really stiff, because you can be stiff, not just flexible.
Oh, interesting. Okay.
It moves around your body all the time because your
Yeah.
tendons, ligaments are going with this. And so what was tight, what was loose, what was weak, what was strong, different sides of the body are different. It can show if you have a loose area, other areas get tight to overcompensate for it. So I've been able to do things like before I do my pole dancing and aerial arts and stuff like that. There's certain exercises and things that I need to do in order to not injure myself again. And even things like it makes you more susceptible to bone density issues.
Oh, wow.
Because you can't hold up your muscles and bones with loose ligaments. So there's a lot of things. And in terms of pregnancy, right? People with EDS are more prone to things like placenta previa and all sorts of different complications, even like miscarriages and stuff.
Oh, wow.
Implantation issues, just all kinds of things. Endometriosis, so many things. But during pregnancy, as you probably know, our ligaments and our hips loosen up anyway, right? So if the doctor knows that you have EDS, there's things that they can do, exercises they can give you, things that they can do to, watch for, and also like maybe if things are really loose, you might need a cesarean, before another person would, or even like anesthesia, for example. People with EDS, sometimes anesthesia works, sometimes it doesn't work, sometimes it works too much. So it's, those kind of things that you can kind of prepare for, knowing what conditions people have.
Could it impact like an incompetent cervix? That's so that's another one. You'd get a cerclage to keep it closed.
Exactly. Yeah, it affects the whole body because connective tissues everywhere, including the brain.
That's so crazy.
It is. It's really, and it's so gratifying to work with people with it who have been told they have everything else, like fibromyalgia. Don't even get me started on that diagnosis, but that's what comes back a lot because
that's
don't know
really crazy,
right? What the root causes are, and even like POTS, like I said, histamine sensitivities. Like there's so many side things that are basically created when we have inflammation and when our organs aren't doing what they need.
It can impact your gut. I mean, it impacts so much.
Huge. Yeah. And the earlier you get diagnosed, the better. And my daughter and I had this running joke, oh, it's EDS.
Right.
I wasn't diagnosed until my 50s, and she got diagnosed when she was 25. So
that's so crazy.
Yeah.
Wow, that's actually eye-opening because it's not something that I have heard, because I see patients all the time. They're always giving me their doctor's diagnosis. I would have remembered it because it's a very unusual name.
Right. And there's a spectrum. So
wow.
There's hypermobility, and then like everything else, it's a spectrum. So even if you don't have full-blown EDS, if you're a hypermobile person, it can still affect you.
Are there any functional medicine approaches that can help it with inflammation?
Like definitely, supplements that help with inflammation and natural stuff. There's a supplement,
or even collagen, taking collagen, or like bone broth. I don't know. Those are the things that I think of off the top of my head.
It's kind of a mixed bag because part of it is that we don't process collagen.
Oh, I see.
Right,
okay.
However, I find taking collagen very helpful.
Okay, got it. And it could be also like certain people might benefit, certain people might not. It's kind of like it's not a one size fits all, even if you have it.
Exactly. And like I use diatomaceous earth, which is kind of a weird little thing, but I use it for hair growth, but it also is silica. So it helps your bones and right. And then there's a supplement I like called Ligaplex too, which also helps with adrenals because it messes with your adrenals, messes with your nervous system, the whole thing. A lot of people that are neurodivergent, links to eating disorders. It's really, really because you don't have a good sense of your body. So your proprioception is off and your body image is off. And
that's interesting. It's so crazy to me because so many people go through these things and they think it's their fault. Right. They don't realize that there is another explanation kind of lurking underneath that is causing them to feel the way they're feeling. And they feel the shame and kind of guilt for getting to the place that they're getting to, but they just don't realize why.
My daughter actually, just from me being me, and then she has the same and different symptoms, even though we have the same subtype of EDS, but she actually went to her doctor and told the doctor all about this stuff. And the doctor was like, well, that's too rare. That doesn't, it really even barely ever happens. And, that just gave her medical gaslighting. And thankfully I have 2 stubborn adult children. She went to somebody else who had more of a background in it. She got officially diagnosed. She went back to that doctor.
Yeah. Good for her. Right? Sometimes that's so frustrating. Yeah.
Right? She was like, this is what I have. And you told me I didn't. And like, you really need to know more so you can help other people. And the woman apologized to her.
Yeah. It's good. It's good. I like it when that happens because it's not to sort of, it's more to educate them. Like to come back because patients educate me all the time. Like I think that as doctors, you need to let your patients educate you because that's how you learn. That's why it's called a practice. You have to connect and really listen to your patients if you really want to become a good practitioner.
Exactly.
Yeah.
Exactly. Yeah. And I think the best practitioners have medical intuitive abilities.
True. And I'll be honest, it's interesting because like I definitely have always been sensitive. I do think that I'm intuitive. I don't like it's not something that I kind of go forward with, but it's true. Like people that work with me know that. But I will never override another person's intuition. So if somebody tells me they don't feel right about a supplement, even if the textbook tells me that is the perfect supplement for them, I will say, listen to your body. That's always just listen to your body. You know best. And I think that that is just kind of like a do no harm. You have to really respect the person's inner intelligence that they only connect with.
Yeah, and teach people how to trust it. Like as accurate as my guides are, and it's really amazing. I tell people, I don't want you to trust my intuition over yours.
Yeah.
Like I want you to consider what I'm saying, but it doesn't mean that like I want to teach you how to develop your intuition. I want to teach you how to talk to your spirit babies.
Well, that's your book. Your book talked a lot about that.
Exactly.
It's like empowering your own innate intuition.
Exactly. And we do need other people. We do, because we have blinders and we have fear.
Oh, for sure.
All kinds of stuff that can get in the way and our own agendas and
absolutely
all that. But I think when you talk to people and they think about times when they trusted their intuition, like miraculous things happened.
It's true. It really is true. And sometimes it's interesting. Sometimes in order to trust your intuition, you're actually given a very difficult choice to make. You have to like do something that is hard to do or like go against people's opinions or go against what your initial expectation was. But then it becomes so worth it. You start to realize there's a reason for that.
Yeah, I totally agree. And if I hadn't gone through all of the stuff that I've gone through, I wouldn't have learned how to, develop and trust my intuition and my weird abilities. And it was really through that diversity. And I like to tell people that other people's pain or your own pain might be the greatest gift you've received. It doesn't make it any easier. But, if you can respond to it and figure out what you need to do to take care of yourself and maybe learn to trust spirit instead of feeling alone all the time. Like, there's so many benefits to it that, even though it's not an exact science and you don't trust it,
everything's so unique. I think that's like on earth, like every person is so unique. Every path is so unique. Even if you have like a similar type of path, it's still unique. You were just talking about EDS and how it's unique with every person that has it. And the same thing with fertility.
Oh my
so
God.
Like people going through that, going through those challenges, it's like any kind of challenge in life, really, where something is there to guide you. I've seen it. I've talked to enough people. I've been doing this in, the podcast since 2018. I've talked to enough people to hear stories and how their end, like the end point, they always look back and they're like, I wouldn't have changed it. But when they're in it, they're like, I don't want this. But then afterwards, they're like, oh, wow, now I see. It's like hindsight shows you the reason.
And a lot of the time, too, I find that people who are having fertility issues, they have really difficult people in their lives, or they hate their job or something like that. So it requires setting boundaries, especially if, you and your partner don't agree on some really important parenting issues or values. Or what I see a lot, too, is people who are concerned about their parents or in-laws and how they're going to be with their children.
Right.
And so it can be an amazing opportunity to stand up to them and set limits with stuff maybe you would have taken from your own parents or an in-law for yourself. And you're like, no way you're treating my kids like that. Or saying that around my kids, or doing, I got a lot ballsier for sure when I had kids, and I was like, no.
And then that's really, I think that's one of the things, like, I feel like fertility challenges set you up for parenting, because you start with advocating for yourself, and eventually you're going to have to make very difficult decisions with kids and advocating for them, even in the medical system. I've had it for many things, doing things that is a little outside the box. I didn't want fluoride in my kids' teeth, and people look at you sideways, but now it's coming out that it's not good. And not being political, like I'm just saying in general, like in general, it's coming out that fluoride is not good for you, and it lowers the IQ of kids. It is what it is. Yeah.
I know I know so many challenging things because yes, it benefits teeth, but oh my God, all the other stuff.
Yeah. And there are other things that can benefit the teeth. Vitamin D.
I know.
Yes. So many things. So it's kind of like that. Like it doesn't end. You know, these challenges never end. And I think that what you're saying is so important. Like really setting boundaries and standing up for what you know to be right. It's really listening to your heart, your integrity, and kind of like staying in your integrity. I feel like that might be difficult at first, but it actually makes your life easier.
It does. Yeah. It's like
kind of like the trick thing that people don't realize.
No, I tell people it's like training a dog. Like you're setting boundaries with your dog so that they don't, pee in the house or
you'll be happy later.
So, and that's how you parent too. And that's how you deal with other people in your life.
Yeah, for sure.
It's not a negative. Maybe it'll make people angry at you. Maybe temporarily, maybe not, but
listen, if people are angry at you when you're not doing something to intentionally hurt them and you're just kind of speaking your truth, then that's a they problem.
Oh, it is.
You're not like trying to hurt anybody. You're just speaking your truth. Then that's, you can't really control that. No. And I say you have to definitely stand your ground. I agree with you. I mean, that's definitely a big thing. Do you, through Spirit Babies, like get messages for things that they want their future parents to know?
It works a lot of different ways. So I encourage.
Right. I think that's the theme for today.
I mean,
it's not a one size fits all.
No. I get messages from children who were not able to come through as healthy pregnancies. Mm-hmm. That's a good way to put it. Even people, and it's awful if you've had an abortion and now you're trying to get pregnant, there's can be so much guilt.
It could be in mind F. I know. I've talked to so many people.
Right?
Yeah.
So I talk to them. I also am able to talk to babies and children who are coming to them. And it's fascinating because it's often biological children, but sometimes it's also children who are going to come to people through adoption.
Mm-hmm. Or I just got the chills because it's true. Like it's still your child.
Exactly. Yeah. Exactly. And maybe I see it all the time where there's a mom or a parent, rental group, whatever you want to call them. And there's this child on the outside and they're not necessarily a baby. And that's often my signal. My guides are like, this person needs to help whoever this is. They're going to connect with whoever this is. And it may come to them in a way they're not expecting, Right. And as we know, there's so many kids who are in need of good parenting and foster care systems awful and, mm-hmm. and all those things. True. And it is very delicate to bring up.
Yeah, it's true. It's true because people have their own plans.
I know. And of course they want biological children. And of course, so I totally get that. But I am honest with people when I do my readings and I'm just like, hey, this is coming through,
I think you have to be because you're a messenger and you can't change the message if that's what it is. And I had Dr. Lisa Miller on who had gone through, actually, it's very interesting. She had gone through her fertility challenges and went through so much to try to conceive. And she kept getting this inner voice come to her and say, if you can conceive, would you adopt or something like that? Like, I don't remember the exact sentence. And would you still adopt? And she was like, no, I want my own baby. And then it kept coming to her. And then at one point she just happened to be, I think it was staying at a hotel or somewhere where there was a program on kids that were orphans. And one of them was inhaling some kind of chemical and said the reason that he does that is because he doesn't feel love. Like he doesn't have anybody that loves him. Of course, anybody who has a heart and hears that, their heart breaks. But for her, it was like this next level of wow, like it really shook her. And at that point, it was it. It was her and her husband, and there was a reason why the TV couldn't work, and it had to be on that. And they ended up adopting in that. And the night before she went to adopt, I think it was outside of the country, she heard the voice again. The question come back to her: would you adopt if you could have if you can conceive naturally? Would you adopt? She said, absolutely. And that month, she also conceived.
Yes,
Do you know what I mean? And it was like those children were supposed to be siblings. It was just the whole thing. So crazy.
A person that I recently worked with, I saw a young boy and an older girl. And I said, one of them is not going to come from you. And I'm like, there's going to be some child you hear about, or some show is going to come on, or some program or something you come across on the internet, and it's going to open your eyes or open your heart to the possibility of adoption. It doesn't mean that you're not going to be able to have your own, biological person too. But yeah, I literally saw them together holding hands, and I get a lot of images through my, with my guides. But I totally felt like, she's like, I really don't even want to go there. I said, I understand. And I'm not telling you what to do.
Yeah.
All I'm saying is look into the possibilities, even doing a donor egg, because that might take that fear of having, a child that is really disabled or something like that, because, and that's not a judgment call. She told me the first time she got pregnant, she had this overwhelming fear that there was something wrong with baby.
Yeah, it was like that intuition. Yeah,
exactly. And then it wasn't viable, so it turned out she was right. I said, see, so your intuition's working.
Right. Although, just for people listening, just because you have a thought like that doesn't mean it's going to happen. Correct. There's a difference between fears, and sometimes fears can trick us. But then there's also intuition, and that is real. Like it feels different.
It's true. And especially, any new mom or any time you get pregnant, of course you're like, I would want this to go well. This is
and you're gonna, and sometimes your mind goes into all kinds of places. What if it happens like this? Or that doesn't necessarily mean it's your intuition.
Absolutely. Yeah. Absolutely. Yeah. There's a difference between fear and intuition. Yes.
It's happened to me before. No. Cause I know, like I know myself, like if I'd be like, oh my God, well, if I feel that, does that mean that it's real? And it feels like that. Yeah, for sure. Like when you're actually going through it. But sometimes you do have like this real strong nudge, like knowing, which is different. But again, it's harder for people who don't like do what you do to really distinguish the difference. How can people actually, that's a good question.
Yes.
How can people figure out what's my intuition and what's my fear? You'd be a perfect person to ask.
There's a great technique in my book for connecting to intuition, and it talks about all of this stuff, but I'm glad that you mentioned it, because people will say to me, like, how do I know it's my intuition or not just a voice in my head or something I made up, right? Or fear or whatever. So what I tell people is whatever you get when you're communicating with intuition, just allow it to be there. Write it down. It's a written technique thing. Write it down. Just allow it to be there without judgment, without fear. And then if something does come through that's scary, then address that and just be like, okay, hello, boys, what is this thing that I'm really afraid of? Why am I afraid of it? What can I do about it? Is this an intuitive feeling, or is it just a fear? So that way you're not pushing it down, you're addressing it.
Right. That's a good point, because sometimes we'll push it away.
Right. And this way you can problem solve. Like, I'm really afraid, that there's going to be something wrong with baby. And then, so that may prompt you to be like, okay, ask your doctor if there are tests that you can do.
Right.
So you can
be proactive. Yeah.
Like in my own case, I felt like something was off. We had an amniocentesis, and I'm not going to get into the whole thing, but it showed like a potential really like huge problem, like stillborn person.
Oh, wow.
Yeah. It was really, really scary. And the doctor's like, most of the time we don't even find this this thing with the cerebrospinal fluid unless there's an autopsy, and it like doesn't affect most people, but it could be worst case scenario. So they're like, you could do nothing or whatever. And I'm like, no, I want the amnio. I want to know, do the genetic testing. And it was torture because at that time it took a month to get the results back. It was freaking torture.
Yeah.
But I was glad I did because they're like, everything's normal.
Thank God. Yeah.
Yeah. And you could carry that fear, or you could be like, I'm going to do something about it and find out.
Exactly. Exactly. Yeah. And that's where you're being guided to resolve. And that's what I like about how you approach this, is because you approach it from a very realistic way where you're actually using action in order to, but also intuition, and you're bridging the two.
Yeah. I like to give people actionable steps.
Yeah.
And okay, all these things are happening and you can't control them and it feels awful and you don't feel like you have any power. But what kind of things can you do? Even if it's even if it's, you know what, I can't control what's going on right now, but I need to go take a walk, or I need to go work out, or I need to go do something creative to calm down my nervous system, let out the stress. That is an actionable response.
Yes, that is true. And your nervous system, I am obsessed with the nervous system. I talk about it a lot because it's an information system. Mm-hmm. So basically it's an antenna. Like, and if it's not, if it's chaotic, you're not going to get the message. It's static. And so you need to regulate it. And that's part of the whole reason why I think stress is, is such a factor. Is we're constantly in fight or flight. We need to even it out and kind of take the other, the other balance of rest and digest, and kind of, I think that when we do that, we're able to get the messages more clearly.
Oh my God. Yeah, absolutely. Yeah. Even right, my own self, if I'm feeling out of it or whatever, I'm just like, you can't go into your reading list this way. You can't create your report and painting and all that. So you need to go do something to chill and then we'll be in a better space. So yeah, it's not just regular people. It's also people who do this for a living.
Oh, it's every person with a nervous system.
That's right.
And it also puts you in a more creative, like when your nervous system is balanced, you're also more creative. You're able to be more creative. True. And what is fertility? It's your physical body's creativity.
It is so true. And our bodies are just so tuned in to what we are thinking and feeling. Yeah. A quickie uterus story. This actually happened to me. So going through a bunch of really intense stress with husband's job and stuff like that. So life was really freaking chaotic. And I had been painting every day. And I'm like, I just lost the desire, and I don't paint like black daggery things anyway. So I just was like too depressed to do anything, and ended up having really bad abdominal pain for a full year. Really bad. Wow. Just holding abdominal pain, like in bed, never knew when it would start, and like crazy. 8 million tests, of course, and no one could really find anything. They did take my appendix out and found a cancerous tumor on my appendix.
Oh, wow.
A rare cancerous tumor. So that obviously needed to come out.
Yeah.
So that was a good thing from all this crazy. But ultimately, the doctor was finally like, okay, your uterus feels weird. And so I'm like, I've had my children, but I'm not doing this pain anymore. Please just, let's end this. So woke up from the surgery and she said, we had to take one of your ovaries too. I'm like, okay. And she said, I've never seen this before in anyone. I'm thinking, yeah, it's me. My fallopian tube had wrapped around my uterus.
Oh my God. How can they not see that in the ultrasound?
It was adhered to it. And I guess the angles, it just.
Oh, wow. That's so crazy. Yeah.
I was like, I know exactly what that is. That is me. I cut off my creativity. I cut off that connection to myself. So my body responded by literally choking off my most creative center, which is the uterus.
Wow. Is that crazy? Yeah. That is so crazy. But I see stuff like that a lot, like, thyroid or like throat conditions. And the people also at the same time have a difficulty expressing themselves to the most pivotal person in their life. And, and sometimes just releasing that, and all of a sudden tears and things come out. Our bodies, it's like that book, Your Body Keeps the Score.
Yep.
It's totally true.
It's, and, Carl Jung and other people like that have been talking about it for, I don't know, long time. And now we're just catching up now.
Yeah. And it also gives you symbols. It'll give you like a reflection of metaphors.
Exactly. Yeah. It's really fascinating. And like, I like to teach people how to talk to your uterus, talk to your eggs, talk to your hormones, whatever's going on, and treat them as your friends.
Mm-hmm.
Not something that you hate or that is broken or that you have to obsess about or even fix. Of course, the goal is to heal. And I did this with healing from my eating disorder was, what do you need from me? Why is this happening? Are there things I need to change in my life? What are you trying to tell me? How can I help you heal? So treat it like a team member.
Yeah, I like that.
In it with you, that's helping you make changes rather than feeling like it's foreign or you're out of your body, you hate your body.
Right, like a separate thing. It's that kind of myth of the separation.
Exactly. Yeah. Exactly. So that takes so much of the anxiety out of it also, because you're like, okay, I do have some control over this. It's not just my body that's doing all these things that I don't want it to do and can't understand. Like,
it becomes more whole, like you feel more wholeness.
Exactly.
With that, it becomes more complete. And there's more closure too, because you're allowing whatever it needs to be expressed to express itself. I remember seeing Dolores Cannon. I'll see sometimes like reels or different things. And she was talking about how your cells in your body, like look at you kind of like your executive function as a god. And like whatever you say, it's like, oh, that must be true. And that's really how your subconscious mind works. And that's why hypnotherapy works, because it's kind of those suggestions that ultimately come from the top. Your conscious mind can make those choices. Right. And then repeat it until it gets into the subconscious mind. Your body and your cells are part of that subconscious mind.
It's true. And even just, I'll be, freaked out about something, whatever, before I go to pole. And excuse me, I'll have a great class, burn off all this energy. And I'll come back and be like, what was I even thinking about? Or a totally different perspective on what was bothering me before. So completely. So much is our mindset.
Yeah, it really is everything, because it's like how we experience our world. And you could take like 10 different people with the same exact life and they'll experience it differently.
Yeah, it's so true.
So it tells us we have choice.
We do. So I'd like to encourage people who are dealing with fertility difficulties to not see their body as the enemy, to be open to all sorts of possibilities. When we release some of that anxiety and stress, we're more creative, like you said. So maybe you think of a problem-solving strategy that no one's brought up before, or that you haven't, or maybe your body will be like, oh, wait, I thought it was this, this, and this, but maybe I need to have my hormones checked, or maybe the testing wasn't accurate, or maybe like it just frees you up.
It does. Yeah.
More answers.
I see it a lot of times with my patients. So what you're saying is actually very accurate. Like, I think that once people, and I see it also once they do acupuncture or like certain practices, they'll start to uncover things and they'll get ideas and they're like, oh, that's interesting. Somebody said something about that, or they'll listen to a podcast and hear like the guest and they're like, oh my God, I think that that's my route. And it just kind of, they start to align and then find answers. So
it's so true. I mean, being a control freak, which I'm guilty of, control freakiness,
all of us,
right? And anxiety, just it interferes more than we realize. And it's almost like people are addicted to anxiety.
Oh, 100%. Joe Dispenza always talks about that. And it's true. Like you could be addicted to stress,
anything,
and like the adrenals, and you could get addicted to the hormones that anxiety and stress give you. You just are so used to it that feels normal. And that's why, abusive relationships, you'll tend to gravitate because that feels normal.
And also, if you're stressed out and your life is chaotic, it's impossible to think about your own needs and your own goals. and your own issues. So it's a way of avoidance, like every addiction is.
Right. That's
The way
such
of
a good
avoiding
point.
stuff that you need to take care of, or that's painful, or whatever. So it's really sad that people sort of choose that route when they do have choices. It's not making people out to be, that it's their fault or anything. But we do have a lot of choice in what we do and how we interact with people, and just setting boundaries or not is a great example.
I agree. I mean, I think that figuring that out and kind of realizing that we actually have so much more power over our lives. I think that that's like that first step of empowerment. You're like, oh, wow. So I think that absolutely it's true. We do have choice.
Right. And even like now it's a bit of a crazy time.
Yeah.
And I'm sure a lot of people are feeling like, I can't change a society or a government, no matter what side you're on, whatever, but there's too much there and I have no power. And it's even fertility is just such a huge issue, right? But if you start being like, what can I do to take care of myself? What can I do to control my issues or when I feel like I'm spiraling? And then maybe I have more power than I think in terms of like getting together with like-minded people or fighting for your issues or, something. So that powerlessness is just such an awful feeling.
It is. It is. And it all has a place too, in some weird way, to teach us or to bring us back to ourselves. I always kind of have the belief that all roads lead to the light, because eventually, even if it's like a really tough time, it'll eventually lead you to some kind of light.
That's very true. And also on the subject of control, I like to tell people it's not all or nothing. So it's not like you're in control mode, all obsessed, your agenda. And the only alternative is to totally step back and give all that up. The way that I like to describe it is spirit, intuition. It's there as a helper. And letting it, like, I recognize myself if I'm going too hard on an agenda or forcing something, whatever. And I can just be like, okay, this isn't working. So step back, allow intuition to come into your life as a protective guiding force. And it tells me when I need to take action and what I need to do. It gives me ideas. It helps me problem solve. So I'm not giving up any control. I'm gaining more by letting spirit into my life.
I love that. I think that's so important. And I'm very spirit forward. It's like I can't do anything without I call them like my invisible assistants.
I love it.
And I'll tell you, like, when you lean on them or in him, whatever it is that you feel connected to, I see them as his team, but whenever you lean on that intelligence, it always shows up. Like, it almost always shows up, like, in incredibly miraculous ways. And I see it with my patients. I see it with my clients. Like, that's the crazy thing, is like the stories that I hear all the time. So it's real, like, it's legit. And I think it's so cool. So for people listening now, and they're like, okay, I want to work with Katie. Like, what kind of offerings do you have for people?
So I basically do two types of readings. One is what I call a full reading, and it comes with a 4-page report and an intuitive soul painting. And
I love that. I think that's so cool.
Just with the name and age, I prepare the full report and the painting. I send it to them. We meet for an hour. We discuss everything I've sent and then a million things more. People can ask whatever they want and more stuff comes up. And then I also have an offering for just an hour without the report and painting. Excuse me. So it all depends on kind of what people want and what they can afford and, stuff like that. They're both effective. And I do sometimes offer a 30-minute too, although it's not on my schedule, but
yeah,
it's an option. So yeah, those are basically the two. And then if people even like they have questions about what we talked about, I encourage them to email me after. So it's not just like you have a question, you have to make an appointment after. I'm not like that.
Oh, that's nice.
Yeah. So because we talk about so much, everything emotional, physical, spiritual that's impacting you in a positive or a negative way, we talk about it. So
yeah.
But yeah, it's a pretty amazing process. I also teach people how to connect to their intuition and their bodies during the visit, if that's something they want to do.
That's
So,
amazing.
yeah.
And how can people find you?
So the easiest way is my website, katiebeecher.com. But I'm on Instagram and Facebook and all the places.
I follow your Instagram. I love her Instagram. It's so cool. And I love all the things that you do, like all the, what was it, the pull work. I think that's so cool. That's hard. That's not easy. It's not as easy as it looks. I can tell you that you have to use a lot of core.
You use your whole body. It's really crazy.
It's insane.
And
it's amazing.
When you have PDS, movement is one of the most important things you can do. What I do is a bit extreme, and I've had injuries because I've dislocated things, but still the best thing I've ever done for myself. And I really encourage movement for stress relief and
well, good for you. It's amazing. So thank you so much, Katie. This is it's always a pleasure talking to you. I really enjoy it. You know, it's really fun. And I think it's important too. It's important. I really love talking about connecting to that, like the spirit or energy. You know, I think it's so important. I think it's a lost art in a way because we've gotten so just into science. Now we're coming back. Now we're bridging it, which I like.
Yeah. No, I agree. And it can be scary, you know, because you're letting your guard down in a way.
Yep.
You know, but that's
where the power is.
Exactly.
That's the portal.
My pleasure, right here.
All right. Thank you.